I have a great honor and pleasure to present Professor Dr. Hesham Salah, Professor of Cardiology at Cairo University. He will be talking about obesity-induced hypertension.
Mr. Chairman, thank you very much for your kind introduction. طبعا it's my great privilege and honor to be here. طبعا أحب أحيي Professor مقلدي for inviting me, Professor جميلة طبعا co-chairman of the meeting, وطبعا أستاذي العزيز Professor محسن إبراهيم, Professor سليمان, Professor وفاء, وكل الناس الجميلة الموجودة. I'm supposed to talk today about an interesting topic, which is hypertension and obesity. The title of my presentation is The Obese Patient, Obesity-Induced Hypertension. According to the WHO, the weight of the word is changing. Most of the world's population is living in areas in which obesity is much more prevalent than underweight. وللأسف الشديد, obesity has significantly increased during the last 3 decades. تقريبا حصل 3 أضعاف زيادة في prevalence of obesity since the year 1975. وأنا مش هتكلم دلوقتي على dangers of overweight and obesity including cardiovascular disease, بس يمكن عايز أفكر حضراتكم برضو إنه osteoporosis, osteoarthritis, cancer, and diabetes are among the more important complications of overweight and obesity. وللأسف الشديد, Egypt has the largest obese population in the Arab world, amounting to approximately 41 million overweight and obese individuals. طبعا ده مش معناها إن إحنا أكترنا من ناحية الانسيدنس. ليه؟ لأن في البلاد العربية بالنسبة للبوبيوليشن بتاعتهم هنلاقي بلاد زي السعودية والإمارات والكويت البريفالنس أو الانسيدنس of hypertension obesity عندهم بتبقى أعلى بالنسبة لعدد السكان، بس إحنا كتوتال population the numbers are greater. And some facts about overweight and obesity: that overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health. وعادة بنستخدم body mass index to calculate it. ويمكن according to the WHO global estimates تقريبا في 1.9 billion adults aged 18 years and older who are overweight, of which approximately 650 million adults were obese. ودي الكلاسيفيكيشن عادة اللي بنحسبها ما بين 20 لأقل من 25 body mass index بيكون ده normal. من 25 لأقل من 30 this is overweight. من 30 لأقل من 35 this is class 1 obesity. من 35 لأقل من 40 this is class 2. And finally 40 or more is considered a class 3 obesity. والحقيقة ان احنا برضو فهمنا ان القصة ليست فقط الobesity ولكن ايضا where is the distribution of fat. ويمكن قصة أهمية circumference of the waist، وان احنا حاليا طبعا اكمننا في مصر ما عندناش ارقام احنا بالذات. يمكن دكتور محسن طبعا يعني عامل مجهود رائع في موضوع الهايبرتنشن، هو مجموعة العمل الجميلة. ولكن at the end of the day we are currently using for the waist circumference the Eastern, the European figures. ودي يمكن types of the obesity. في common type of obesity، في obesity due to stress وعادة بتبقى accumulated in the abdominal area، في the so-called gluten obesity، في metabolic obesity، في venous obesity، and finally في obesity due to immobility. وطبعا في طرق أخرى للدescription of obesity included what we usually used to call apple shaped or pear shaped or hourglass or inverted triangle or the ruler type of obesity. ويمكن مهم قوي ان احنا قبل ما ندخل على الهايبرتنشن and obesity نتكلم عموما بسرعه على الهيلث consequences of obesity including انه بيبقى كتير عندهم some mental problems، حاجات ليها علاقه بالchronic respiratory problems، cardiovascular including an increased risk of stroke, ischemic heart disease maybe, hypertension اكيد. 13 types of cancer are increased with the presence of obesity. musculoskeletal complications، وطبعا المشهور جدا كان الميتابوليك syndrome. في برضو a long list of medical complications related to obesity، ولكن أنا مش هدخل فيها وهركز على إن ال obesity is finally an imbalance between the food intake and the energy expenditure. في multiple players including leptin, including adiponectin, including some gut hormones. بس برضو لازم نبقى فاهمين إن there are some syndromes and some medical problems which lead to both hypertension and obesity زي الhypothyroidism وزي الكوشنج syndrome. Hypertension on the other hand البريفالنس بتاعها بيزيد significantly في وجود obesity. In grade 1 obesity بنتكلم على تقريبا 72% عندهم hypertension. In grade 2 77% and almost the same figures in grade 3 obesity. عادة بيجدوا in the children with 2 obese patients are 10 to 12 times more likely to be obese than their counterparts. In a systemic review وجدوا ان the birth weight usually is translated in the future that they develop also obesity. على عكس الهايبرتنشن a low birth weight is usually associated later on in life with hypertension. The mechanism of obesity-induced hypertension, on the other hand, is quite complex. عادة بنلاقي إن there is sympathetic activation في ال obese patients. و at least the onset of obesity-induced hypertension بيكون some sort of hypervolemia present. في renal mechanisms also implicated, including the impairment of pressure natriuresis. The RAS system is quite commonly in these patients activated. Multiple hormones, including the leptins, including insulin, and other neuropeptides are also implicated. Finally, there is a strong role for the endothelial dysfunction as one of the important factors leading to obesity-induced hypertension. Finally, لما بنيجي diagnose hypertension بنعمل almost the same investigations except if we are thinking of ان يكون في some other secondary cause which is causing the obesity. فبنعمل some additional investigations. بس الحقيقه قبل ما ندخل في التريتمنت انا عايز اسال حضراتكم هو الobesity is a secondary form of hypertension ولا لا؟ ما رايكم؟ يعني هل obesity is listed as one of the secondary causes of hypertension ولا لا؟ Yes؟ لا يعني انا لو بصيت كده على الجايد لاينز هلاقي ان obesity مكتوبه كواحده من secondary causes of hypertension. secondary causes of hypertension الحقيقه مش هنلاقيها. هنلاقي انه sleep apnea syndrome مكتوبه as a secondary cause of hypertension. بس obesity في some sources are writing it as a secondary cause of hypertension بس في guidelines it's not mentioned like this. اما بنيجي نبص على treatment of obesity الحقيقه we are having multiple weapons. مش كلهم very effective. دايما بنبتدي بالrisk factor modification including diet and exercise. ولكن في some drug therapies that can be used as well as surgical techniques. اما نيجي نبص على weight loss strategies for prevention and treatment of hypertension هنلاقي ان الميديترينيان دايت له ايفكت كويس. ليه؟ لان بنلاقي انه في نسبه من العيانين دولت according to randomized controlled trials have found that taking Mediterranean food leads to a significant reduction in both systolic and diastolic blood pressure. الداش دايت نفس الكلام، ويمكن حتى بيقلل الضغط بنسبة أكتر من الميديترينيان دايت. On the other hand, intermittent fasting وده موضة حاليا وناس كتيرة بتتكلم عنه، لقينا إنه according to the data available أوكي ممكن يكون له effect في reducing الويت، ولكن usually it is not something which is sustainable، وفي نفس الوقت يمكن ما يكونش له الإفكت المطلوب قوي من ناحية توطية الضغط. Physical activity on the other hand is quite important. وفي different mechanisms by which physical activity leads to a significant improvement in weight loss as well as a reduction in blood pressure. Where there is evidence that physical activity and exercise training reduce obesity, blood pressure, وبيقلل في نفس الوقت ال cardiovascular risk and complications. Achieving 5 to 10% of one's body weight loss can lead to أكثر من 4 ل 5 ملم reduction in systolic and diastolic blood pressure. ويمكن الحاجة الغريبة شوية اللي الناس ما تبقاش متوقعاها حكاية reducing sedentariness. يعني إيه؟ إحنا أحد المشاكل اللي عندنا إن إحنا بنقعد على الكرسي بنذاكر بنعمل حاجة ما بنقومش. مجرد إن أنا اخلي الفتره اللي انا قاعد على الكرسي فيها ديت تنقطع حتى وقوف، مش هقول حتى تقوم وتمشي شويه، no, just standing up has been found to be effective in reducing blood pressure في الناس who are already hypertensive. ولكن للاسف الشديد كمان this has not been done in randomized trials، ومش فيش وسيله قوي ان انا اقدر اتحكم في المده اللي انا بتكلم فيها، اللي يقعد 10 دقائق ولا نص ساعه وبعدين يقوم. عشان كده this is not mentioned clearly in the guidelines. طبعا حاجه من ضمن الحاجات المهمه ان احنا فاهمين انه الدايت والاكسرسايز بيبقى لهم some excellent effects وكل حاجه، ولكن مجرد انك تبطلهم ده بيؤدي significantly ان الويت يرجع تاني، ودي احد المشاكل that we are usually facing. بالنسبة للدراج administration they have been shown clearly to have some significant effects. في medications و at least 4 of them are having an FDA approval for short-term reduction of weight. في 4 medications which are FDA approved. طبعا لهم indication ان يكون الواحد البودي ماس اندكس بتاعه اكتر من 30 او اكتر من 27 ويكون عنده some other risk factors. On the other hand, for the long-term medications, there are 5 FDA-approved medications. بس أنا عايز أقول إن هم they have been shown إن هم to reduce hypertension. إنه أما بندي أدوية والضغط بيوطى والويت بيقل بيحصل reduction in the blood pressure. ودي يمكن some of these medications ويمكن اللي حاليا مشهورين قوي هو الأورليستات والليراجلوتايد والسيماجلوتايد. وزي ما حضراتكم شايفين these are the percentages from trials showing the reduction in blood pressure. بس مش عايز ننسى ان some of these medications are amphetamine related، وبالتالي there has been at least a theoretical assumption that they may increase the blood pressure، ولكن on clinical grounds this has not been shown. طبعا الموضه اللي حاصله حاليا وكتير قوي من بالذات السيدات بيروحوا يعملوا sleeve operations وبيعملوا bariatric surgery، ولازم نبقى فاهمين that this is not without complications. اي نعم major complications are less than 5%، ولكن there are complications including a mortality rate of less than 0.2%. The current indications are a body mass index of 40% or more or 35% or more with comorbidities. الغريبة إنه these medications these procedures do not reduce only the weight. They do reduce blood pressure according to trials. ولكن هم حتى من غير الميكانيزم اللي بيوطوا بيه الويت لهم other mechanisms usually endocrinal، بس مش هدخل أنا في details but there are multiple mechanisms for reducing the high blood pressure in such patients even if the weight is not that significantly reduced. ويمكن systematic reviews of observational trials and data have suggested that this metabolic surgeries improve hypertension. وكان في داتا على أكثر من 22,000 عيان مبينة that there was a 63% resolution، مش مجرد reduction or control of blood pressure، resolution of hypertension. يمكن ال only trial الوحيدة اللي هي having a hard endpoint or a target endpoint which is blood pressure was the Gateway trial وبرضه showed a 30% reduction in the total number of blood pressure medications while maintaining office blood pressure. And my final slide, which are my conclusions, that the relevance of both hypertension and obesity as important public health challenges is increasing worldwide. Obesity, and in particular central obesity, have been consistently associated with hypertension and increased cardiovascular risk. Finally, there is a clear need to develop a global strategy for managing the increasing number of overweight and obese subjects in the community. Thank you very much.
Okay, thank you very much, Hesham. It's excellent as usual. We have no time for discussion, معلش. Thank you. لو حد عنده سؤال هنسأل الدكتور هشام.
متأخرين.
اسألوك بعدين بقى.
مفيش مشكلة. Thank you very much.